We can hear you. Good evening, sir.
All right, thank you very much. I think I have less than 5 minutes or thereabout for this talk, so I'll really run through it. But I want to greet you, Dr. Annie Nchiewe. I want to greet all other presenters. I want to greet all the Pink Empresses on the platform, and I want to thank you for this opportunity. I was just asked to give a few remarks on nipping cancer in the board, and I sent my slides to Victor, and I hope he's sharing it right now as we speak. Talking about nipping cancer in the board, and thankfully a lot of things have been said already about prevention, because basically nipping cancer in the board is about prevention. You know, there are various levels of prevention: primary prevention, secondary and tertiary prevention. And if you're able to do all of that, you are literally nipping cancer in the bud, because what you are doing is to stop it from progressing beyond where it's a major problem for us, you know? Primary prevention, you are talking about stopping somebody. I think we should move to the next 1 or 2 slides. I am rushing through this because there's somewhere else I should be in the next few minutes. Victor is aware of that.
You want to go by battery?
So, are we there? Because I'm still seeing my initial screen, and I think I should be moving to about the 3rd or 4th slide right now. So, you know, when you're talking about nipping cancer in the bud, you're talking about basically prevention. Primary prevention is all about trying to ensure that an individual doesn't even get a disease in the first place. Secondary prevention is trying to ensure that even if the individual gets the disease, you catch the disease early, and as such, you are able to stop the disease from making any significant impact in the individual. Well, tertiary prevention is, well, you've got the disease, but at whatsoever stage you've got the disease, you do everything possible to give the most optimal treatment so that, you know, serious side effects, serious, you know, devastating effects will not, you know, occur as a result of that disease. So yes, we're talking about, you know, prevention, that screening, treatment, and all of that. I think we should move to the next slide, because the next slide talks about prevention, and it all boils down to what we can do as much as possible. Victor, please, next slide. What we can do as much as possible to reduce the cancer, or to stop the cancer in the first place from occurring. There are only very few cancers that there are vaccines for the exact cause of the cancer. For instance, cancer of the cervix, which has human papillomavirus as a known cause of over 90% of cases, and as such, you know that if you give HPV vaccines, you are, you know, stopping individuals from getting over 90 to 95% of cancers of the cervix. There's also the the HBV, that's a hepatitis B virus, which would stop an individual from getting hepatitis B, and as such, stop an individual who has taken the vaccine from getting hepatocellular carcinoma, that's cancer of the liver, that is as a result of hepatitis B virus infection. So in situations where there are, where there's a vaccine that could prevent a cause, that is outrightly the best thing we do. We encourage everybody to get a vaccine. However, if that is not possible, every other thing comes down to a lot of lifestyle modifications, and a lot of that has already been talked about. Dietary modifications, exercise, quit smoking, reduce alcohol intake as much as possible. All of those, protection from sunlight, protection from various forms of carcinogens and all of that. With all of these, all we're trying to do is to reduce the possibility of getting a cancer in the first place. All that is about primary prevention. Well, if we cannot prevent it primarily, then the next most important thing is about screening. And screening is all about trying to catch a cancer in an individual long before that cancer even shows any symptom whatsoever. Not all cancers can be screened for, but it's important that for those that we can screen for, screening be encouraged. And screening entails an individual getting up when there is no symptom whatsoever, walking to the hospital and say, I want to get screened because I fall into the range of age for which this disease is common, or I want to get screened because I have these and that risk factor for this particular disease. So yes, screening becomes very important, and everything we can do to encourage screening, we would encourage it. Everything we can do to encourage better screenings with better sensitivities and better, better specificity, we do all of that. And then diagnosis. You see, the unfortunate thing is most cancers present with clinical features that are very similar to other cancer, to other diseases that are not cancers. So we want to encourage our colleagues to have a very, very high index of suspicion, because it is when the patient comes and complains about something, and in as much as that thing could be as a result of a few other benign conditions, you as a doctor quickly realize that cancer could also be a differential diagnosis to this condition, and as such, you suspect cancer early. That way, we are able to catch diseases from patients who present, instead of thinking, oh, it's ulcer, and we keep treating ulcer before we get to realize that it is cancer of the stomach. Oh, it's pile, it's hemorrhoids, and we keep treating hemorrhoids before we get to realize that we're dealing with a rectoanal cancer and all of that. Most cancers have symptoms that are similar to other diseases that are not benign. And it's important we have a very high index of suspicion so that we can catch them early. I think I've exceeded my 5 minutes. And the next most important thing I can talk about is treatment. So we want to encourage that for those whom we are unable to catch at the screening phase, for those whom we only catch at the time that they present with symptoms, the next best thing to nip cancer in the bud is to ensure that we give the most optimal treatment feasible. Good radiotherapy, good brachytherapy, that's external beam radiotherapy and brachytherapy, good chemotherapy, as much as possible, targeted therapy, hormonal therapy, all of these various treatments for cancer, we try to incorporate them in a multidisciplinary team setting so that as much as possible, the patient gets the very best of care and we prevent side effects from our treatment, and we prevent the disease from progressing and leading to an unwanted event in the long run. Well, like I said, I was rushing through and I wasn't able to catch up with the 5 minutes. I think I've entered the 6th going 7 minutes, but I want to thank the Pink Africa Foundation for this opportunity. I hope my slides made any sense, because I just see Victor flipping from one slide to the other. Once again, thank you very much for this opportunity, and God bless us all. Thank you very much.
Amen. Thank you, Dr. Otene. We appreciate you. And I want to add that for stage 3, the best cancer treatment center in Nigeria is the Ukpo Cancer Center. It's located in Calabar. I've taken a personal tour of the whole facility. I'm sure that there are patients who can attest to facts. So please, if you are a cancer patient in Nigeria and you want where you have multidisciplinary approach to cancer care, Ukpo Cancer Center is the place to be. Thank you and God bless. Over to the people on ground.